My name is Howard Nations, and my firm is heavily involved in hip implant litigation. With the DePuy ASR, which has been found to be defectively designed and it's been recalled from the market, let me tell you why you need to confer with an attorney, because let me tell you what the dangers are from having the DePuy hip implant ASR in your body right now. First of all, there are three categories of our patients, and we've talked to more than 500 people, so we know what the situation is, and with our clients. Here's what we've learned. The average use on this is 2 to 2.5 years before failure. The average age of our clients is between 40 and 45. The situation is with respect to three categories of clients. Number one, we get those who have had no symptoms. Number two, we have those who are going to require surgery, revision surgery, because they're already having symptoms and their symptoms are worsening and they're destined for revision surgery. And number three, we have those clients who have already had surgery. Now let me explain to you why, regardless of which of those three categories you fall in, that you need to talk to an attorney about your rights before you do anything with respect to DePuy. The defect in the product is that the cup is too small. It's a cup and ball situation. The cup and the ball interact obviously as you move. With the cup being too small, there is movement and there's what is called edge loading. And the edge loading and the smallness of the surface between the space between the two surfaces leads to what is referred to as lubricant strangulation. Between those two elements, edge loading and lubricant strangulation, you get wear. The wear creates metallic debris. And here's the important part. The metallic debris is chromium and cobalt. And the metallic debris is coming out, it's coming out in two forms. There's a soluble form and there's a non-soluble form. The non-soluble form is particles of cobalt and chromium. And that's doing two things. One is it's interfering, it's mixing in with the ball and joint and causing additional wear. The other thing is that we're finding particles lodged in organs where they've moved through the bloodstream and lodged in organs. The other type, and this is the part that you have to be concerned about even if you haven't had any symptoms so far, are the soluble ions of chromium and cobalt, metallosis. We don't know at this point what is the effect of the chromium and cobalt in the blood. And it's currently being researched at Bristol University in England, but the results won't be in for a while. There's a study being done and the results will be in, but it's months away. So at this point in time, if you sign away your rights to a DePuy litigation with Broadspire or with DePuy, you effectively have signed away all of your future rights. Now, the way you can tell if you have a DePuy ASR is if you have been contacted by your doctor and told them to come in for a blood test, if you've been contacted by DePuy directly, if you've been contacted by Broadspire, which is their agency that's adjusting their claims. They will tell you, we're here to pay for your revision. What they don't tell you is there's an awful lot more to your damages than just revision, because we don't know the effect yet of the blood, the so many parts per billion of chromium and cobalt in the blood. And also what they're not telling you, the most important part of this is what we do know about the effect of particles and the soluble ions in the tissue and the muscle, is that when you do surgery in that operative field, you're destroying bone. The chromium and cobalt is killing tissue. The chromium and cobalt is severely damaging muscle, including the abductor muscles, which are extremely important to hip implant patients. Now, when you have to go in for your revision, and they have to go in and take this implant out. And then they have to work again in destroying more bone. They will have to cut away all of the dead tissue, and they can't do anything really to repair the muscle, but they're going to do more destruction, both in taking out the current one and putting in the new one. Then you've hurt the operative field again. Now, you keep that one in for 5, 6, 7 years. We know that it will not last as long as the 15 years they've promised you this one would last. But what we do know is that because of the damage to the operative field, it will be a shorter life for the second revision. So you're going to possibly need a third revision, or depending on your age, a fourth revision. What Broadspire is not telling you when they're trying to settle with you is anything about, wait a minute, who's going to pay for the second revision, the third revision, and on down the line. Now, at some point in time, you can get to be ineligible. You're not a good candidate for surgery anymore because there's nothing left in the operative field to work with to put in a new hip. So the problems in the future are the major elements of damage with respect to this DePuy litigation. Now, the question people want to know is, do I have a defective hip device, and if so, what do I do about it? You can tell if you have a DePuy by a letter from your doctor telling you to come in for a blood test or that there's been a problem, a letter from Broadspire, or a phone call from Broadspire, or any kind of direct contact from DePuy. The other thing you can do is you can look at your airport card, and it may just say DePuy, but it won't tell you that it's whether it's an ASR or what type of device it is. We will, without charge to you, determine for you exactly what type of device you have in your body. Secondly, who's the manufacturer? Third, is it a model that has been recalled? And fourth, what are your rights with respect to this, whether it is a DePuy, a Zimmer, or a Stryker, because all of those, there are recalls with all three of those companies. So if you are having the symptoms of hearing a clicking noise, feeling pain in the hip, the thigh, the groin, having swelling in the hip, and you're getting intensified pain, and you're having difficulty walking, and you're unsteady, you feel loosening, or you feel instability in the hip implant. These are symptoms that would indicate that you are in a worsening condition that will never get better on its own. So under those circumstances, you need to talk to a lawyer, and you need to talk to a lawyer who specializes in mass tort litigation and in medical device litigation. And that would be my law firm of Howard L. Nations. You can call us at 1-800-269-3050 or go to our website at www.howardnations.com. Thank you very much.